Nonunions. Sometimes bone fractures doesn't get united. Skeletal traumas results often with bony fractures. According to severity of the amount of the energy absorbed by the traumatized extremity is very important. In patients with inadequate treatment or circulatory problem or metabolic disorders or infection or fractures may not heal or heal inadequately. Bones that do not heal after fracture are called nonunions or pseudarthrosis. Nonunions occurs when a bone that is broken either from an osteotomy, surgical bone cut, or a traumatic event fails to heal during the course of several months. Nonunions often occur when the fracture site has either too much motion or too little blood supply for healing. These nonunions often are associated with significant deformity, pain, leg length discrepancy, and occasionally infection. Pseudarthrosis means false joint because the unhealed area of the bone has motion like a joint. These usually occur after trauma or surgery and mostly affect adults. A special kind of pseudarthrosis occurs in children without trauma. The bone fractures spontaneously. This is called congenital pseudarthrosis and occurs mostly in the tibia and forearm. If the nonunion is infected, it usually requires remove the dead infected bone and growing back healthy bone. This can be accomplished by acutely all at once, shortening the limb to eliminate the bone defect and then lengthening the bone at an alternative site, as described for limb lengthening. Alternatively, we can use a special technique called bone transport with which defect is shortened at the same rate as the limb is lengthened, thereby not changing the length of the limb at any time. Both shortening with re-lengthening and bone transport result in a limb that is restored to equal length and normal alignment and that is solidly healed. It is sometimes necessary to insert a bone graft, the patient's own bone, at the old nonunion sites as part of these treatments. Bone grafting of the nonunion sites can be combined with internal or external fixations. Bone grafting is usually avoided when there is active infection. It can be performed later as a separate procedure after the infection is eliminated. Pseudarthrosis is hard to treat. If you have any question, please turn us. Have a nice day.